All right, today we are playing Dental Detective. We're going to investigate a really strange phenomenon that can leave even the most seasoned dentists just scratching their heads. It's the mystery of the shifting bite. So, let's dive in.
So, picture this. You're a dentist, and you're prepping a back tooth for a crown. You do everything perfectly, creating just the right amount of space, let's say 2 millimeters. You have the patient bite down to double-check your work, and poof, the space is just gone. It's like you did nothing at all. It's one of those what is going on moments, and it is right at the heart of our mystery.
Okay, so the scene is set. A dentist does their job by the book, with precise measurements, textbook technique, and yet the result just seems to defy logic. The space they just made simply disappears. And listen, this isn't just some hypothetical scenario. As Dr. Jaz Galati puts it, it's a real and really frustrating experience. It can even lead to that phone call that no dentist wants, the one from the dental lab saying, "Hey doc, we're going to need more space here," leaving the dentist just completely mystified.
Now this is the crucial part. This has nothing to do with skill or how long you've been practicing. The best dentists in the world have seen this happen. It's not a mistake, it's a biological phenomenon. It's a hidden little quirk in our own anatomy that decides to show up unannounced.
To solve this mystery, we have to uncover a fundamental clue. And it's a pretty surprising one. Your jaw doesn't just have one bite. It actually has two completely distinct positions. And understanding the difference between them, well, that's the key to everything.
And here we have it, the official name for our culprit, last tooth in the arch syndrome. It is exactly what it sounds like. A situation where working on one specific tooth, usually the last one in the row, sets off this chain reaction that causes the whole jaw to shift, and just like that, the space you created is gone.
So, let's break down these two different bites. First, you've got your normal bite. You might hear dentists call it MIP. Think of this as your best fit bite, like putting together puzzle pieces, where your teeth just slot together perfectly. But here's the thing. To get that perfect fit, a little muscle often has to pull your jaw slightly forward. Then, you have the hinge bite, or CR. This is your jaw's true natural resting spot, where the muscles are totally relaxed and the joint is seated all the way back.
And here's the kicker. For a staggering 90% of us, those two bites are not the same. There's a tiny little difference, a small slide or a shift, between where our jaw naturally wants to be and where our teeth actually fit the best. And that little discrepancy is where our whole mystery begins.
So how in the world does this difference between two bites cause a perfectly good space to just vanish into thin air? Well, the answer is all about muscle memory, and one single critical point of contact.
Okay, so when your jaw is in its most relaxed, natural hinge position, usually only one or two back teeth will touch first. That first little touch acts like a trigger. It literally programs your jaw muscles. It tells them, okay, we're here now, so we need to slide forward just a bit to get all the other teeth to meet up. It's a learned, totally automatic movement.
So what happens when a dentist preps a crown on that specific guide tooth? By changing its shape, they have, completely by accident, removed that first point of contact. They've erased the trigger. All of a sudden, the muscle's programming is just gone, wiped clean.
And here's the final piece of the puzzle. Without its sole programming, the jaw just does what's natural for it. It relaxes and settles back into its true hinge position. As the jaw moves up and back, the bottom teeth go with it, and bam! The 2 millimeter space the dentist just made is suddenly history. Mystery solved.
So, now that we know the how and the why, a whole new question comes up. Can we actually predict who this is going to happen to? Because it turns out not everybody has the same risk.
The risk goes way up for patients whose teeth don't give their bite a clear roadmap. So if you've got flatter teeth from years of wear, or if your teeth don't interlock like a tight jigsaw puzzle, your jaw muscles don't have as much guidance. They rely much more on that single first touch point. So when that's gone, the shift can be really dramatic.
Now, on the flip side, if you have what we call cuspy teeth, with lots of well-defined peaks and valleys like you see in a young person's mouth, your bite is incredibly stable. Even if that first contact point gets changed, all the other interlocking cusps give so much guidance that the jaw finds its way back to that normal bite, no problem. For these folks, the risk of a big shift is very, very low.
Now, this whole thing might sound like a dental nightmare, but here is the good news. It is completely predictable and it's totally manageable. This is a solvable mystery, and skilled dentists know exactly how to screen for it before they even pick up a tool.
The screening for this is actually pretty simple.
A dentist uses something called a leaf gauge. It's just a little stack of thin plastic leaves and places it between the front teeth. This separates the back teeth, which lets the jaw muscles forget their old programming and just relax into that natural hinge position. Then, by removing the leaves one by one, the dentist can find the very first tooth that makes contact. This tells them which tooth is the potential trigger and lets them measure just how big that potential shift could be.
And this right here is why that screening is so powerful. This quote just nails the importance of communication. When a dentist can spot a high-risk patient ahead of time, they can explain the situation. It becomes a conversation about the patient's unique biology. But if they wait and try to explain it after the space has already vanished, it just sounds like an excuse for something going wrong.
At the end of the day, this knowledge is power. It prevents any nasty surprises, it manages expectations, and it lets the dentist and the patient work together to make the best possible treatment plan. They can talk about different ways to approach it, all because they knew about the risk from the very beginning.
And that really is the biggest takeaway from all of this. While the technical stuff is fascinating, the most valuable thing for any of us as patients is to understand our own bodies. Knowing about your own unique bite makes you an empowered partner in your health. So maybe the real mystery isn't just about how a bite can shift, but how much better things can be when that kind of knowledge is shared.